clarifying question. So some people tell me that when choose scoring somebody and their care escalates, that you need to do a sepsis trigger tool every single time. But others tell me that it's just at the beginning of the shift. Can you just tell me exactly which way to do it?
So Dee Dee, that's a really great question, and I have heard throughout the hospital that people are struggling with this a little bit. So you need to complete a sepsis trigger tool at the beginning of your shift when your patient is a yellow or red choose. And the reason for that is we want to increase screening of patients who are not at their baseline. And if you're a yellow or red choose, you're clearly not at your baseline. However, we don't want to make nurses crazy by making them do sepsis trigger tools throughout the shift. If their patient choose score changes, we're giving the critical thinking back to the bedside nurse. If you think your patient is at risk, is looking like they're septic at all, then clearly you can do a sepsis trigger tool at any other point during your shift, but you only have to do it at the beginning of the shift if your patient is a yellow or a red choose. So great question.
Okay, so Jennifer, can you explain to me about the sepsis trigger huddle? I'm getting a little pushback. Is it supposed to happen at the bedside, or can this happen in the conference room? Can you give me more of what to do and if it should actually be occurring at the bedside, because I'm getting pushback?
All right, Kim, another great question about a sepsis huddle. So I know it can be challenging on some of the inpatient units to gather the team together when your patient triggers as septic appearing, but it's critical that the team come to the bedside and assess the patient and communicate directly with one another. And when I say the team, I'm talking about the bedside nurse, the charge nurse, the resident or NP, the senior resident, whoever is on your team needs to come to the bedside. A sepsis huddle should not be done over the phone, because then there's a lot of miscommunication about what needs to happen next. The attending does not have to be present, but does have to be notified by phone that there was a bedside huddle that occurred. So excellent question.
Okay, Jennifer, the last time we did a sepsis huddle at the bedside, I asked the docs to use the sepsis order set. They kind of rolled their eyes at me and didn't think it was important. Why is it so important to use the sepsis order set?
Jackie, so that's another great question about the use of one of the bundle elements for sepsis is the use of the sepsis order set. It's really critical for providers to utilize the sepsis order set if they're ordering antibiotics for a patient that appears septic, because it triggers a page to a pharmacist, and it's sort of like a superstat. And it lets them know that the team is concerned about sepsis in a patient, and they will get the antibiotics up much quicker. We have tracked data on the use of the order set, and every single time antibiotics are used, antibiotics are ordered using the order set, they get administered faster than if they're ordered just separately without the order set. So it is really helpful for the bedside nurses to remind the residents to utilize the order set, especially as we enter June and we're going to have a whole new group of residents.